Now, President Trump is finally taking action on the disastrous opioid epidemic that is killing a lot of Americans. Now, according to the CDC, opioid addiction and overdose is now one of the leading causes of death in America among those over the age of 50. And so far in 2016, I should say, it has killed about 59,000 people. And so far in 2017, it kills about 200 people a day. So that's staggering, right? Now, in the face of that, those numbers, which are very, very stark, the Trump administration is rolling out its new plan in order to take on this crisis. And basically, it's the Just Say No program. Yesterday, he gave a speech declaring the opioid crisis a public health emergency, at least temporarily. Now, what that means is that the federal government, thanks to that declaration, will now waive some regulations, give states some more flexibility in how they use federal funds, and expand the use of something called telemedicine treatment. And like I said, it is temporary. It lasts about 90 days. So, America, you've got 3 months to go clean up the opioid epidemic. Oh, by the way, we're really not giving in that much extra money, so you're pretty much on your own. Now, the president just stopped short of declaring a more sweeping national state of emergency that would have given states access to funding from the Federal Disaster Relief Fund, just as they would have during or following a tornado or a hurricane. Now, so he's like, it's a disaster, but it's not that much of a disaster. It's more of like a moral failing, I guess. Hey, if you're addicted to pain pills that were sometimes prescribed for things that maybe it shouldn't have been prescribed for, well, then it's your fault for taking them and getting addicted. I mean, we're not going to do that much. We're going to do a little, but not that much. His proposed solution is just a continuation of the war on drugs. Which is funny because we have a war on drugs already, and it's failed miserably. We had a Just Say No campaign for other drugs, and guess what? It didn't work. It failed miserably. Now, in his speech, he said that one of the things our administration will be doing is a massive advertising campaign to get people, especially children, not to want to take drugs in the first place, because they will see the devastation and the ruination it causes to people and people's lives. So again, this is more, hey, don't do drugs. Oh, wonderful plan. You're going to tell people not to do drugs. That worked wonderfully before. Now, what's even more frustrating is that this is aimed at children. Now, kids, look, kids are not the ones being affected by the opioid crisis the most. I mentioned before that most of the people who are impacted by the opioid epidemic, the ones who are actually getting addicted and dying, are mostly over 50. These are adults who get prescribed powerful pain medication. They get hooked on that medication, and sometimes, and oftentimes, they'll end up going towards stronger medication. So this does nothing to address the real problem. The roots of this problem are from the drug companies that are pushing doctors to prescribe things like OxyContin to people suffering from chronic pain, right? Again, these people are overwhelmingly white, middle-class Americans over the age of 50, not children. Now, we need actually to invest money in more people on the ground to help people, you know, bring alternatives to addicts who are going through withdrawal. Withdrawal from opioids can actually be fatal. So, you know, there are other drugs that can help people who are withdrawing from opiates to be able to do so more safely so they don't die. And then, of course, we need more treatment centers and things like that. Now, we also need to go after the drug companies that are pushing those doctors, you know, to basically be drug dealers for this legal substance. So this is something that is going to last far longer than 90 days and needs lots and lots of investment. We do not need another war on drugs and another Just Say No campaign. That's not a solution. It's not even a Band-Aid. This is somebody who's basically saying to someone who lost their leg, hey, walk it off. By the way, telling a nearby child, don't get your leg cut off. Yeah, great advice, dude. Great. Oh, you don't want to end up like that guy. Just say no. look, of course, the GOP and Trump do not actually offer real solutions to this problem. Why? Because, look, I think and we've demonstrated this before, it's sort of the Republican conservative belief that taking drugs is a moral failing. Only bad people get into drugs, right? And if you had just been smarter, and if you had just said no, like Nancy Reagan told you years and years ago, and the D.A.R.E ads told you, then you wouldn't be in this mess. But since it's affecting so many people, and since we made campaign promises to actually do something about it, then I guess we got to do something a little bit. This administration is facing a crisis, and they're so inept, they don't know how to do it. They don't know how to fix it. And it's incredibly frustrating to see that they're taking the cheap way out and not actually addressing the real issues behind it. But again, I didn't really expect a whole lot better from this administration, and it sucks to be proven right. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.